I'd like to ask you both permission to use this video for educational purpose and on the internet.
Absolutely.
Yes.
You have a lots of questions about what exactly we did. Now, I want you to ask those questions online so I can answer it. I'm sure lots of other people have the same questions, okay? Now, but before we do that, how bad was your pain before the surgery?
Oh, I got to be a 10, couldn't sleep through
How
the night.
long? How long was it 10?
Well, I needed the surgery for 3.5 years.
Yeah, long time. Now, how bad is the pain now?
Only if I do something, overdo it at my age,
Yeah.
it's 0.
Okay.
Until I overdo
So the
it.
pain did go away.
Absolutely.
Now, the surgery was about 16 months ago. Do you remember the surgery?
Oh, God.
Yes, you do. So how long did you stay in the hospital?
Just overnight.
And then your surgery was less than an hour. We lost 1/5 of a cup of coffee blood. And practically next day you went home. When did you notice that the legs are different?
The legs, what do you mean?
The leg pain. You had leg pain before?
No.
Mostly
that's
back
something
pain?
I didn't have.
Yeah,
I
back
had
pain.
back pain.
When did you notice that the back pain is different?
Well, pretty quick.
Pretty
if you
quick.
just don't do anything.
So now we are going to talk about what we exactly did, because now we didn't do a small surgery, we did a big surgery, and this is what we did. We put 2 spacers and 6 screws in your back and practically stabilize your back, and literally this is what we did. You were sleeping and you were like that. This is back, this is front, this is up, this is down. We first actually went through the second, I'm going to here, and the third disc from below with a tube barely thicker than this pen. Then we took the content of the bad disc out and we put a spacer to open up the space where the nerves is coming out. Then we put 6 screws in. Those screws are in this here, in this bone here, and this bone here on both sides, and we put a rod together. I used 1 incision on here, just above your pelvis, to 1 hole to change the angle and put the spacers in.
Mm-hmm.
Then I did multiple incision in the back, and I'm sure you have seen that. Where you have, you have multiple small incision in the back where each screw has its own kind of poke, and as well the rod goes from up here, comes across, and then we lock them in place. Now you have a lots of question about the size of those screws. This more or less is a human size, a realistic size of a human body. You see those screws have to be this big to go from outside here, and the head of the screw is actually much longer, which we remove, and then this rod passes through, and then the cap comes up and lock it in place. So now it's the time to ask all your questions you want to ask about.
Well, first thing I'll say, the incisions, you never feel them.
Yeah.
That's minor to get
Good.
over.
Yeah,
It's
and
just
lots of small incision.
Protecting yourself and the sniff just till
Yeah.
it heals.
Yeah.
And then it's a matter of doing what you can do more from before that you couldn't. You just don't want to overdo.
Yeah. Now.
And then a year later, you're pretty much doing everything until
Yeah.
the next day you go, oh, I just overdid a little.
Now, I told you something that you shouldn't be doing. And you
Yeah.
remember, what did I tell you? What not to do?
Trampoline, bungee jumping.
Bungee jumping, yeah.
But I have partial uni knees. I don't jump.
Yeah. Okay, so
So-
excessive things, right?
Yeah.
Okay.
And I would assume things you never did before you shouldn't do after.
Well, the same thing that would make the spine go bad, make as well your other joint go back. And it has not necessarily something to do with the surgery we did. It's just about,
Age.
it's about if you overuse it, it's going to wear and tear faster.
Because
So,
we're older.
well, we are not 20 anymore.
Make me say my age, 66.
Well, you're still a very young 66, but the idea here is 66 is, however you take it, is not 26. So if we pretend we are 26, and if we do things that we did when we were 26, we're just going to overstress our body
Right.
at some extent or another. But you had some good question for
Well,
me.
yeah,
Now you
the
don't want to ask
screw-
those questions?
Well, the screws, when you brought it up to scale to size, I can understand why they're that size. They need to be
Yeah.
to hold this. Overall, it was just, I can't believe I put it off for 3.5 years,
Yeah.
but I had to find the right surgeon.
Yeah.
Gotta find the right surgeon, guys.
No, I know what's
do.
different about this surgery and the way I do it is that I don't fillet your back open to do
No.
the surgery, because in a regular surgery, you cut it in the middle. You literally, not figuratively, you fillet the muscle away, they all die, and then to get just access to these spaces that we talked about, I just do them all with a tube that is barely thicker than the spine. That's all the difference is. Less damage doing the surgery, faster recovery, and better outcome.
Well, and I, as a patient, had no idea, that you were doing that, because I don't feel anything afterwards. I can see those 11 or 12, I can't remember the count, but I never felt them.
Well,
There was never any
that makes
impact.
me very happy.
Yeah. I mean, internally there was, but
Yeah.
not externally.
Now, first night is rough, and admittedly, first night when you wake up after surgery can be, not all the time, but can be rough.
Yeah.
You're tough.
Yeah,
That's fine.
I think you're tough. I think just initially waking up, we
Yeah.
won't refer to that, because that's so minute and so temporary.
But people get so fast better.
Yeah.
That's amazing compared to open surgery. I just had a patient upstairs that I did a surgery yesterday. I did a 3-level fusion, and that patient, it was a big deal. Even University of Minnesota said that she cannot have that surgery.
Really?
We did the surgery in 1 hour and 7 minutes, and she's ready to go home.
Well, I could see if I was working, I could manage to go to work part-time, which
Yeah,
I always
yeah.
was 4
Yeah.
hours. It would be a little tiring until you got, as you gradually got better, you wouldn't even notice.
So, any other question or anything comment that I can answer for you? Otherwise, thank you so much helping me to demonstrate what this surgery is about. Okay?
Thank you for letting me tell people that you were awesome.
Oh, thank you so much. That makes my day.
Thank you for getting your education and sharing it.
Well, thank you so much. I'm going to shake your hand, okay? Thank you very much.
Thank you, Dr.
Okay.
Abbasi.
You're